It's a great day and welcome to QPI series Q-Tip of the Week. My name is Jennifer Long. I'm the VP of Business Development here at QPI Healthcare. And today we will be speaking with Wanda, our HEDIS director. She wants to discuss some of the most common missed details that could be lost revenue for your practice. Wanda?
Hi guys. Let me just start by saying there are so many common omissions in charts that are keeping your care gaps from being closed. And we all know that an open care gap is lost revenue. So let me just give you a few examples of it. I won't hold you long. The first example is you got a patient, you go and get their weight, you put it in real quick, and you didn't bring the height over from their previous chart. Okay, so you have the weight in, the BMI won't calculate. That's lost revenue because that care gap did not close. A simple one, a very simple one that you shouldn't be missing. The next one is lead screenings for patients that are under the age of 2. Those lead screenings need to be done before the age of 2 years old for that to help that patient or help that care gap. Yes, the patient needs it regardless of their age, regardless of the time you give it to them. However, it needs to close the care gap. To close the care gap, it has to be done before age 2, on the second birthday or before. You can't a week after, that care gap will not close. That's lost revenue. The next thing is a simple annual physical that a patient came in for, and the chart didn't get signed off. You've done all your things, spent 45 minutes in there headed to assessment for the patient, done everything, and the chart is not signed off. That is all that time you spent. You lost the revenue for the annual. You lost the revenue for just 45 minutes of your time and out of your day that you've spent. And that care gap will not close. The annual care gap will not close because the chart, simple thing like the chart, you have 90 days to get a chart in. You've missed that window by not signing off that chart. The next one would be a simple postpartum visit. If you have that patient come in before 7 days or after 84 days, that care gap will not close. However, the patient needs that postpartum visit, the gap is still open. The next one is simple statins. When you're a diabetic patient, you documented that the patient is diabetic, you've given them their statins per regulations, and the patient is complaining of pain. Go ahead and document that pain in your chart. Allow your coder to send that out. That should close the care gap for you, and you won't have to prescribe that patient or put that patient through those statin pains anymore. Even simple stuff like the frailty of a patient. A patient has 3 chronic diseases over age 65, and their health is declining and they're looking a little bit frail. Document their frailty. Document all of that in a simple code will get that care gap to close. And the frailty would exclude them from quite a bit of other normal things that we have for care gaps. And we all know closed care gaps is money in the bank.
Thanks, Wanda. We all want money in the bank, don't we? Just remember, there are so many common omissions that could be keeping your care gaps from closing, in turn causing that lost revenue. To learn more, call us today or visit our website and request a meeting. We'll talk to you soon. Bye for now.